and weather station.
And good afternoon. Thank you for tuning in. News Talk 95.3, Michiana's news channel. I am your host, Casey Hendrickson. To the rescue, Amy Drake. Amy, how you doing? Thank you so much for rescheduling.
I'm doing well.
Yeah, I appreciate that. Congressman Banks got roped into a meeting, and I had Amy on a little bit later, but now it looks like he would be butting up against your interview, so you were able to come on a little bit earlier. I appreciate you being flexible. I wanted to talk. Sorry, I didn't mean to interrupt, but I wanted to talk about this article that you have in the Federalist. Indiana governor wants 29 times more funding for the bureaucracy that brutalized public health. Did I read that right? He wants 29 times more funding, not percent more, but times more.
Right now, our public health offices in Indiana, altogether, they get $6.9 million. He wants to raise that number to $200 million annually. So, yes, 29 times as much.
Holy smokes. And we kind of looked at this on the national level not that long ago, but you know, when you're looking at this, what is the reasoning that they have to want to go ahead and increase the budget so much now that the emergency, okay, air quote, the emergency is over with? Why do they want to increase this budget so much? What is the reasoning behind it? Why is it necessary in their opinion?
Well, it's interesting. Like, can I back up a little bit with you on that?
Yeah, please do.
Okay, so, you know, in 2021, we had our legislators here at the State House pretty much rebuke the way public health handled all the lockdowns here in Indiana. Mm-hmm. And what they did was they told the health officers they could no longer issue these unilateral orders because everybody was, you know, flipping out everywhere. So we did that. And a few months later, Holcomb called a public health commission together. So he organized this big commission to study public health. They were supposed to look at the positives and the negatives of public health. I was really nervous about this commission because I figured they would just come back and ask for money, and that's what they did. And if you look at this report, there is nothing in there about how they handled COVID. And if anything, the last thing we want public health to do in Indiana is grow in money and in workforce after what they did to us.
Right.
And that's exactly what this money calls for. And it also calls for centralizing public health in Indiana and actually getting to the point where local officials will sign off and give decision-making authority to the state. And going through COVID, what we know is that our local officials were kind of our measure of safety from the State Department. So the last thing we want to do is be even more connected to them at this point. So they obviously didn't get the message. They have not acknowledged any errors in their ways. And now we are supposed to give them all this power.
Now, what is the reason for this dollar amount? I mean, is there a specific reason, or are they just like, we just want a nice, big, juicy, round, $200 million? Was there?
It was.
Go ahead.
Yeah, it was figured. I can't remember the exact dollar amount now, but what they basically did was they looked at all public health funding in the country, and they said, well, and I don't remember, this could be wrong, but it was something like we're doing $54 per person, and we want it to be at, I think it's 91, something like that. And so they said, so let's just raise it to that. That was all they did to come up with that number, which is, very crude.
Now, again, you're looking at the state of Indiana, and I understand that there are other parts of the state that, have some issues. There's certainly an issue with, unhealthy lifestyles in many parts of the state. People in Indiana do tend to be overweight. There's still large swaths of the state that are engaged in smoking, and I know that there are, previous movements in the state government to try and reduce those efforts. But, I mean, I'm just trying to understand how we get to, and I know that I'm trying to, make logic out of something that's illogical here, Amy, but how is it that, those programs we already have, which cost us $6.9 million per year, what are they going to do that is going to increase their scope so much that we need $200 million a year now? And how does this throw into basically a wrench into the machine when we're talking about a proposal to get rid of the state income tax? We're talking about issuing taxpayer refunds, and now there's $200 million per year. Poof, just gone.
Yeah, it's just amazing how much they're asking for, and it's really, for them to be able to claim that big government is going to come in here and fix mental health and fix, and look at mental health. That's one of the areas that Holcomb said he was focused on with this money,
right.
in fixing. Like public health is going to come in here and fix mental health. I mean, they have done so much to hurt mental health with the lockdowns. I mean, we look at all of the kids that are still damaged, that were isolated from their friends, that had their senior year of high school cut off. Kids that went to college that were, forced to social distance and stay in their dorms by themselves. We had, raised suicide rates. We have people using, substance abuse. All of these things, the idea that a big government bureaucracy, the one that hurt us so bad, is going to come in and fix our mental health is ridiculous. I mean, the fact that they think they're going to, bring our smoking rates way down, or they're going to make everybody less fat. If your personal doctor can't do that, why do they think a government program is going to suddenly fix it? So, Holcomb is known for these big spending programs, and he's obviously not in touch with any real Republicans.
Now, one of the things that really concerned me in your article, and again, we're talking with Amy Drake, county councilwoman, but also wrote an article here in the Federalist. Again, Governor Holcomb has proposed to take our annual health spending from $6.9 million to $200 million. And he's not really just going to, give this now. Like from the state budget, this is just not going to go to the counties. So there's an additional one. You're getting requirements from the counties to get this money, which means your local governments are going to get more tyrannical, right, Amy? And then on top of that, there's going to be expenses that local governments don't have to pay that now they will have to pay in order to go ahead and meet this new funding match, because it's an 80-20 rule, is it not?
Right. So what they want to do is set up this overall program where you have to opt into it. Your county commissioners have to opt into it. Right now, our local governments cover most of the cost of their public health. They want to switch that around so all the money is coming from the state. And when you hear how much money they're going to give you, right, like there's going to
almost all going to flip.
There.
Right.
Yeah, and they're all and some of these little small health departments can't meet their funding, can't meet all their requirements anyway. So the idea of having a lot of funding and them saying no, well, they're going to have to say yes to this. So you're going to have all these people that feel like the financial incentive to join is there. And then for those people that, maybe don't want the strings, what was interesting about all the discussions with this plan is when they were putting it together, Luke Kenley, who's the former appropriations chair, who's one of the co-chairs of the Public Health Commission, he was saying, all those questions everybody had about like how they didn't like the governor's mandates, or how they had questions they didn't want to be told to vaccinate. They wanted their local leaders to have power. Well, this way that we'll all be on the same page. In other words, if you sign into our program, we're not going to have all these questions about what was right or what was wrong or what you don't like. We're all going to be on the same page. You're going to do what we say. So that to me is one of the most concerning strings that's going to be in here. And like for us, like St. Joe County, if they offer us, whatever, $5 million, right, and whatever they're going to offer us, and if we would say no because we don't want those strings where the state can now tell us, whether we have to have a mask mandate or whatever, then our constituents are going to be mad too, because we're turning down money that they may think will help their health. Right. So they're putting us in a tough position. We're either going to say no to our constituents, we don't care about their health, or we're saying yes to government strings and more bureaucracy in our counties.
Well, that's exactly what Governor Holcomb wanted to do, and he doesn't have to answer for it in another election, so why not? And in addition to this, too, and I'll link to Amy's article in the Federalist in the Daily Show Prep today, but there's you wrote that there's 10 additional statutory duties that are now going to be incumbent upon those counties as well, which are, again, that all has to be funded, by the taxpayer and the constituency there. So this is very, very concerning. And hopefully, I mean, do you have any bearing here on how this would be played out in our legislature?
Well, I have really worked to spread the message. I know that some other organizations are working to spread the message too. I'm hopeful. I mean, we have a pretty conservative House. I hope they realize. I mean, I can't imagine that you're looking at something to be funded 20 times the rate at where it's at now, and you're just like, sure, okay, no problem. And with that idea of how bad all the COVID lockdowns were to our society. So I'm hoping the combination will keep them rational and but you never know at the Senate. The Senate is always kind of carries Holcomb's projects. So we need everybody who's in your audience, if you've got, a public official that you're close with, a senator or representative, contact them, because they need to hear that we don't want this. This is a waste of money for us.
And part of these terms, too, are basically that you're turning over authority to the state here. We're going to make all those decisions, whereas there was at least a little bit of that decision-making process throughout COVID held at the local level. That would go away with this, which is ultimately the goal. Amy Drake, again, St. Joseph County Councilwoman in South Bend. Thank you so much for the time. Great article, great piece. We'll link to it. And we appreciate you being flexible with your schedule today.
Thank you. Bye-bye.
Right, you take care. So I will post this up on social media, but it will also be in the daily show prep at btmedia.news. It's also on btmedia.news. If you go into the news section under the conservative news aggregator, just go to the Federalist, and you should see the link directly to the article there as well. We've got more coming up. News Talk 95.3, Michiana's news channel. You can watch live, rumble.com/Casey the Host, Odyssey at Casey the Host, or listen live in the MNC app, which is totally free to download, or online at 953mnc.com.